Hello, my name is Chloe Abney, and this is my final video presentation on nonverbal communications. I chose to talk about nonverbal communications through the perspective of a doctor and patient relationship. I chose to talk about three main different nonverbal communications: kinesics, touch, and vocalics.
Hey, Mrs. Ashford.
Did you find out?
Press against my hands with the bottoms of your feet. Find out what?
About my house. It has the most beautiful crumble.
Now with your hands. I'm sorry, I haven't had time to ask about your house. How's your vision? Any blurriness?
My vision? I don't care about my... Stop! Stop this nonsense. Just took a call. Somebody please find out about my house.
Ma'am, this isn't nonsense. I'm trying to help you, and I have about 20 other patients, so checking on your house is the last thing on my mind right now. People got injured badly. So you need to stop worrying about your house, and you need to tell me if you are experiencing any blurriness of vision.
So the first nonverbal communication we're talking about is kinesics, and the textbook definition on page 112 is the name given to all forms of body movement excluding physical contact with another's body. On page 113, our textbook says that vision accounts for around 80% of our sensory perception. That's a very large amount of everything that we notice and see around us all comes from our vision. And in this clip, you can see, and we can use our nonverbal communication skills of kinesics to learn that the doctor is clearly extremely rushed by her body language, by everything she's doing. She's doing it super quickly. She walked right into the patient's little area, never took a step or a break in her walk, was just moving very fast. You can also tell from the body movement of the patient, she's clearly not doing very well. She seems to be maybe an elderly patient with the looks of her face. You can see more wrinkles in it. She also is not having the best movement. She's kind of stuck laying back in the bed. When the doctor's asking to push against her hands, the patient's not able to do a very well job of this. The second nonverbal communication that I chose to talk about is touch, specifically instrumental touch, also known as professional touch. Now, in our textbook on page 154, Heslin and Alfer talk about there being 5 main categories of touch, all defined based on levels of intimacy. The textbook also said on page 155 that this type of touch is instrumental because it helps people complete necessary tasks. Obviously, this is instrumental touch. You can see through the doctor because she's using touch to complete her job, which is to give a checkup onto her patient. She needs to use her touch in her hands to be able to feel how well the patient can push against them and see all the different pressure points. The third nonverbal communication I chose to talk about is vocalics. According to our textbook on page 132, this is the way we talk. For example, accents, emphasis, pitch, loudness, pauses, silence, laughters, and sighs. These are all just basically everything that we say when talking, or the way that we talk without the actual words that are coming out of our mouth. Now, the textbook also talks about on page 133 that the human ear is capable of perceiving frequencies ranging from 16 to 20,000 Hz. Hz is an abbreviation for hertz, meaning that 20,000 hertz equals 20,000 cycles per second. Now, in this clip, you can see the doctor, or you can hear the doctor in the way that she's talking. From the very beginning, she's not taking very many breaks. She's just really right on to what she has to say. She's talking very fast, and even further on in the clip, especially towards the very end, you can hear that she's getting more aggressive with what she's saying. She's being louder, she's being more direct, she's being shorter with her patient. And all this goes to show that she's super overwhelmed. She has a lot going on. She even said that she has a bunch of other patients, so you know that there's a lot going on. And you can just tell from the way that she's talking, she doesn't have time to make small talk. She's not really interested in getting to know the patient or making the patient feel more comfortable. She's really there just to get her job done. Now onto my references. For this project, I mainly used our textbook, and then I also used this clip from the show Grey's Anatomy that I found on YouTube, and there are both my references.